Welcome to this show discussing problems and issues of health with Dr. Alcena. For this segment, I'm going to continue to talk about high cholesterol. High cholesterol is a very, very common medical problem. In this country, you have 106 million 700,000 folks with high cholesterol, and across the world, it's in the billions. Suffice it to say, it's a serious problem, and it can lead to a lot of complications such as heart disease, strokes, eye problem, kidney disease, etc. Now, when I left off last week, I went through the whole basic notion how to examine a patient, what the different tests to do, etc. In this segment, I'm going to begin to start treating the patient based on the result that's coming back for the cholesterol that's ordered. When you order a cholesterol, you basically order a lipid profile. And the lipid profile has 7 parts to it. It has the cholesterol, the total cholesterol. It has the LDL cholesterol, the HDL cholesterol, the triglycerides, and the ratio of the cholesterol slash HDL cholesterol. Those are the things that we look at. So when you get the result back, let's take the easiest one first. That is somebody you order the lipid profile, and all you get back that is abnormal is the total cholesterol and the LDL cholesterol. That means the patient has high cholesterol and nothing else having to do with triglyceride, etc. You also want to take a quick look at the HDL cholesterol, because the HDL cholesterol is crucial in helping to remove the cholesterol, the cholesterol from the bloodstream. Okay, now now that you know that the total cholesterol is high, the LDL cholesterol is high, the HDL cholesterol is either low or normal. If it's normal, it's fine. If it's high, it's fine. If it's low, that's a risk factor in itself. So now we're going to go about to try to treat the patient. Well, before you're going to treat the patient, you have to know how the medications work and what's the underlying reason, first of all, that you have the cholesterol elevated, and then what you're going to do about it. There is a substance in the blood, in all our blood, called hydroxymethylglutaryl-CoA reductase. I'm going to call it coenzyme A from now forward. What that is that this happens to be the genetic abnormality that causes the cholesterol to become elevated in the first place. And when you inherit the abnormality from your parent, what you in fact is hereditating from them is that you have a problem that is located in the long arm of chromosome number 5. That abnormality that's located in the long arm of chromosome number 5 leads to the situation whereby the coenzyme A is overactivated. That's the abnormality. The overactivation of the coenzyme A in your blood causes you to overabsorb cholesterol when you eat it in your food. That's the problem. That's it. That's the problem. So then if you're going to treat the cholesterol, which we're going to start doing in this segment, then you have to come up with medications that's going to attack. I'm talking about cholesterol itself, not triglyceride. I'll talk about that later. You have to come up with medications that's going to attack the coenzyme A. That's what you're going to have to do, because that's what's overactivated that's causing you to overabsorb cholesterol. When you overabsorb cholesterol, too much of it wind up in your bloodstream, then that leads to deposition of the cholesterol inside your arteries that then causes you to develop plaque, and the plaque then leads to narrowing of the vessels that cause you to have ischemic disease of one type or to one degree or another. So now you understand that. So the medications that are out there, they call them statin. There are many of them on the market. Many of them on the market. I have this chapter chapter 3, which is on high cholesterol. I copied from this book, The Art and Practice of Modern Clinical Medicine, that I wrote in 2016. I'm going to go to this section where I listed here the different different uh, uh, medications that are out there. Okay. In addition to that, even before I get to that, what is very crucial is diet. Diet is very crucial because the more fat you eat in your diet, the more some of the fat is going to wind up as part of the cholesterol. The more simple there are two types of carbohydrate in the world that we eat in our food. There's complex carbohydrate, there's simple carbohydrate. All simple carbohydrate must, by definition, some of it must turn into fat. All of it. And then the classic example, an easy example to understand of what simple carbohydrate is sugar, regular sugar. And all foods that has regular sugar in them, that's simple carbohydrate. When you eat simple carbohydrate, either you drink it or you eat it, some of it, and of course all sodas, all liquid sodas have simple carbohydrate in them. All food that has sugar has simple carbohydrate in them. All bagels, all white bread, all these things have simple carbohydrate in them. And the simple carbohydrate, when you eat it, by definition, must go. Some of it is used immediately to supply the body with immediate energy so that we can survive. The rest of it, however, goes to the liver. When it gets to the liver breaks them down into fat. Let me repeat that. The liver breaks the leftover simple carbohydrate into fat. And the fat, some of it get dumped into the circulation as cholesterol, and some of it stay in the liver, causing damage to the liver. That is why. That is why number one cause of liver disease in the world, cirrhosis of the liver, happen to be obesity. That is correct. The number one cause of cirrhosis of the liver, which is the most devastating disease of the liver besides cancer of the liver, is of course cirrhosis of the liver, which itself can lead to cancer of the liver. Okay? If you didn't understand that, you didn't know that, now you know that alcohol can cause cirrhosis of the liver, hepatitis can cause tons of other stuff can cause cirrhosis of the liver. But the number one cause happens to be obesity. What is one of the leading diseases across the world? Obesity. How about that? Now, one of the living of all the developed countries of the world, which country has more obesity than any of them of the United States of America? There are more obese people here, 49%. 49.9%, close to 50% of all American adults in this country are obese. How about that? And between 13, 14, 15% of children and adolescents are obese. Therefore, there's no other country of the developed countries in the world that have more obese person than the United States of America. I'm clarifying this for you because it is crucial that one understand these things so that you understand how bad simple carbohydrate, when you eat in excess, can be to the body. That's right. We need simple carbohydrate because we need energy. And one of the energy that we need the most is the simple carb that we use so that we can. But when you eat it in excess, the rest must go somewhere. That somewhere is to the liver. The liver breaks it down into fat. The fat gets distributed to the soft tissues, and the individual soft tissue become big, they develop obesity. The rest, there's so much of it, the rest stays in the liver, and it damages the liver. You say, well, what's the mechanism? How can fat damage the liver? Well, when the fat sits in the liver, by necessity, it must degrade. That's right. And as the fat is degrading in the liver, what happens to the liver? It causes the liver, it causes local inflammation. Anything that's degrading in the body must release free radicals. Free radicals begins the process of inflammation. How about that? So now you understand why the liver get damaged. You understand that all other tissues get damaged when the fat sits there too long. Because the fat don't just sit there. It sits there. The body is reading it as a foreign substance. The body is fighting against it. So therefore, it's going to degrade. That then causes a local inflammation. This is why obesity is such a bad, bad, bad disease. It's not a condition, it's a disease. So therefore then, let me give you a little spiel about complex carbohydrate. There are lots of complex carbohydrates. I'll give you a classic example, pasta. Let's take pasta. Pasta, spaghetti, those things are complex carbohydrates. They are very good food. What makes them good food is that when you eat them, they can't make you fat. Pasta cannot make you fat. Spaghetti cannot make you fat. What you cook with it can get you fat, can cause damage. But the pasta itself, the spaghetti itself cannot. Why? The same thing with brown rice, brown bread, plantain, banana, all these things. I mean, they can't yum. All these are complex carbohydrates. You say, well, how come you don't get fat from them? Because the human body was not created by God to break complex carbohydrate down to the point where it can go into fat production. That's why we don't have that in our physiology. When you eat those complex carbohydrates, they provide they have two things they do. Pay close attention. Two things. They satisfy hunger, which is very important. The second thing they do, they provide an immediate form of energy. Let me repeat that. All complex carbohydrates satisfy hunger and also produce an immediate form of energy to the person that's consuming them. That's correct. Now you've heard that the marathon runners, before they go to the big races every morning or the night before, they consume large amount of pasta. Now you understand why they do that. That's the reality. This book that I wrote, The Art and Practice of Modern Clinical Medicine, if I may pick it up for you, it's the biggest book I've ever written. It has 156 chapters. It's The Art and Practice of Modern Clinical Medicine. It has everything having to do with medicine in the 20th and the 21st century. If something is not in there, that means it's not of a major significance. It's there, and it's 2016. And a big, I think, 2 pages on complex carbohydrate, the different types of food, and 2 pages on all the food that has simple carbohydrate on them. So now that you've gotten your spiel on what simple carbohydrate is, what complex carbohydrate is, that's important because diet plays a major role in high cholesterol. Diet does not cause high cholesterol, but diet contributes to making it worse. So when you're going to treat somebody who has high cholesterol, clearly you give them a talk like I just did to explain to them the type of food that's good for them, the types of food they should avoid or eat very little of. Okay, so diet is key. Now that you understand, diet does not cause high cholesterol, the disease, but diet contributes to make it worse. Good. So now that you got that spiel, the patient laboratory result comes back, the blood count is normal, the chemistry profile is normal, very important, your analysis is normal, the thyroid profile is normal, blah, 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 so on and so forth. So now you want to take a look at, remember, when we order cholesterol, we order a lipid profile. Now that's what abnormal, what I just said before, that comes back. There are different categories of abnormal lipid diseases. The first one is the type 1, which is whenever it is only the cholesterol and the LDL that's elevated. That's type 1 hyperlipidemia, okay? All right, now that you understand that, that's very, very common. I'll be getting to talk to you about the other types as we go on. So when we order a lipid profile. So now, let's begin then the process on how we go about treating the cholesterol. We tell the patient to cut back on food that have simple carbohydrate. We tell the patient to exercise. All this is very important. We tell the patient to eat a diet that has high protein, low simple carb, and a lot of fruits in it. Of all this stuff you heard about there, and I'm not knocking anybody's commercials, I'm not bothering anybody's ability to sell stuff, to make money, blah, 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 blah. But suffice it to say, these are people who are making money. Many of these people never went to medical school. They don't know what they're talking about. They're just in the business of making money. Some of them are good, some of them are not so good. I sit down sometime listening to these things because the commercial comes and I can just sit here and laugh. I can sit here and laugh because I recall either the second or third book that I wrote in 1992 was a little book. I think there's some of it either over my shoulder there or we have somewhere in the studio. I wrote a little book on diet. That little book, I think, was we published many times, and a lot of people became famous because they plagiarized it, blah 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 blah. It was all about explaining at 1992, mind you, explaining to everybody what a high protein diet mean, what's the low fat diet mean, and all the different food. I even went and explained a lot of different recipes that I listed, blah 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 blah. But I'm not in the business of writing book for money. What do I care? As long as it was helpful to everybody, that was I was interested. All attempts that have been made to commercialize the show, some of it, the attempts were being made for bad reason because they wanted me off the air, and they thought that if they take control of the show, they can tell me what to say, what not to say, and in this way they could get credit for it to push me out. I said, you could keep your money. I'm not interested in that. I practice medicine to earn my living. That's good enough for me. I'm not interested in being wealthy or whatever. So I pushed them away. I remember one time, one guy, I know exactly what the outfit is, obviously I would name it, sent me a 21-page contract to sign so that I can join forces with them. And I sent it to my lawyer, and then we read it. It was a takeover. And I just laughed, and the poor guy, I felt so bad for him. He sounded a very nice man. He called me, and then when they hear my accent, I speak with a thick French Haitian accent, and he thought that I was a pushover. And then I talked with him. I spent about 2 3 months talking with the guy, and he didn't know that I was making him revealing himself. At the end, I just smiled at him and then said, it was nice knowing you, blah, 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 blah. And that was another story. By the time he realized that, he had fallen into what we call the Valiere Alcena trap. The Valiere Alcena trap is what I was telling the student a couple of days ago, is what I shouldn't tell you, but what do I care at this point? It is something called intelligent naivety. Yeah, I explained that today. He was laughing his head off. Explained to them what is intelligent naivety mean. I explained to him, but I wouldn't explain to you because I don't want you to know all this factors. So, but I explained to the student. You could try to figure it out yourself. What intelligent naivety. So this is the Val Alcina syndrome. Okay, and to this day, people are still falling for it. And by the time they realize that they're talking to somebody who is probably a trillion times smarter than they are, they already reveal themselves because they fell into this Val Alcina syndrome, which is basically the intelligent naivety syndrome. Suffice it to say, all right, let us now tell you the different statins that are out there. I'll use the brand name because when I wrote the book, this is the brand name. You have Zocor, you have Lipitor, you have Lescol, you have Mevacor, Crestor, you have Pravastatin. Those are the most common ones. A whole bunch of other ones came out since this book was written. Suffice it to say, the mechanism of the statin, they're all the same. They all work via the same mechanism, which is to block. That's right. They block the overactivity of the coenzyme A. That is exactly correct. When you take the medication, what you're doing, you are blocking the overactivation of coenzyme A, which is the genetic abnormality you inherited If you have type 1 hyperlipidemia, which is the high cholesterol, and that means you inherited from your one parent. If you were to inherit it from both parents, it would be a different category. Okay, so so that means that if you inherit it, that doesn't mean it's going to appear right away. Sometime when your cholesterol becomes elevated in your late 30s, 40s, or early 50s, that means that you have type 1. Because people who have the other types that are homozygote, they start having a problem with lipid abnormality in the adolescent. Okay, so now you understand that just because you don't have it now doesn't mean you're not going to have it later. It just takes time to show up. Okay, if when you have type 1. So basically, all these statins that I mentioned to you and there are others that are on the market, they work via one way and one way only to block the overactivity of coenzyme A, thereby preventing you from overabsorbing too much cholesterol. That's all it is. And then the cholesterol, so where did the cholesterol go? Well, what it is that it blocks that, therefore the cholesterol gets shifted right to the liver as opposed to sitting in large quantity in the circulation. When it gets shifted to the liver, it gets mixed up with the bile because it gets mixed up with the bile, and then the bile then go into, when you have a bowel movement, the bowel movement is very brownish. The more brownish it is, that means the more cholesterol you are taking out. Ordinarily, that's the color of a normal feces anyway, it's brown. But it becomes more brown, intensely brown. That means that you're really getting all that garbage out of the circulation, and it goes mixed up with the bile, and you're taking it out. It doesn't stay in the liver either. You push it right out, and it goes out via the stool. Okay? So that's how it works. That's how type 1, which is high cholesterol, high LDL, that's why all the statins work. Okay? So now, if you have type 2 hyperlipidemia, that means that the cholesterol is high, the triglyceride is also high. How about that? So, the triglyceride is another form of fat. And the way we handle that is different. What we do is that we have a series of medication. We have the lopid, tricol, cholestyramine, and then we have trilipix, lipofen. These are medications that specifically created to take care of the elevated triglyceride. Remember, when the triglyceride is high and the cholesterol is also high, that is, the triglyceride is moderately elevated, the cholesterol is high, that's type 2. Okay? And that those medications, the way they work differently. They don't work via the blockage of coenzyme A. Those are raisins. They actually grab the lipid. That's right. They grab the lipid. You know what a raisin is? You mix it with something, you grab the raisin and then take them out. That's how they work. And there are several of them out there, okay? And then you prescribe them together with the medication that you prescribe for the cholesterol. There has to be two types. A statin plus, let's say, tricol, for example, or lopid, for example. So the patient, right away, this is a patient that have type 2. If the patient wind up having type 3 hyperlipidemia, that's when the triglycerides are extremely high, super high. That's type 3 hyperlipidemia. You go right back the same way, you just simply increase the doses of those raisins. You have to understand, the elevated triglyceride is also bad for your vessel, in particular your arteries. And then we talk mainly about arteries around the heart because that's what people hear all over the place. The trick is we have arteries all over the place. And all these arteries are affected by elevated fat, all of them. The largest arteries, of course, is the aorta in the chest, the aorta in the abdomen, and wherever there are arteries, they could be in your eyes, in your kidney, in your heart, in your brain, arteries all over the place. Because the arteries and the high flow systems are all over the place. So that's what we're trying to do. But the key thing to understand, and that is crucial for you to understand, that is to say, all this medication must be given at night. How about that? If you take this medication in the morning, they do not work. You say, well, what is this all about? Well, you have to understand physiology, the way God created the body. At night is when we have the most fat. That's right. When we have the most fat in the circulation is at night. In particular, half hour after we eat our dinner. So therefore, you want to use this medication when you have the most fat in the circulation for them to block. That is why if you take this medication, let me repeat that, if you take this medication in the morning or during the day, they won't work. Okay, so you must remember, and I'm sure your doctors will tell you, your physician will tell you, these medications are prescribed to be taken half hour after dinner or at bedtime. If you don't do it, they won't work. You're wasting your time. This is a very crucial point because that mistake is being made again and again and again. People are spending all that money to pay for the medication, they're not taking it the right way. I'm sure the doctors explain to them why this is crucial. There's a whole lot of things that happen to our bodies. That's the highest at different times of the day. For instance, little do you know that you go to work, you're upset, you're working hard, you're doing all sorts of stuff, your adrenaline is high during the day. But guess what time when the levels of adrenaline in the human body is the highest? How about that? Between 3 o'clock and 4 o'clock, 5 o'clock in the morning. How about that? Every day, the highest level of adrenaline that's circulating in the blood, unless we have pheochromocytoma, blah, 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 which is a different situation, is in the morning. That is why what time the most heart attack occurs? In the morning. Most heart attack occurs when the highest level of adrenaline is in the body, overstimulating a weak heart, a sick heart, you got a heart attack. That's why we have medication that covers for that part of the day. Okay, we have medication that we give patients that covers that part of the day so that when the adrenaline level is so high, that medication blocks it to prevent it from overstimulating the heart. And most heart attack occurs Sunday night through Monday morning because of the anxiety, getting ready to go back to work, especially if we hate the work that we're doing, we're anxious, we're secreting a lot of adrenaline. Okay, between Sunday night and Monday morning, and bango, we have heart attack. Listen, I'm going to stop here. Until I see you again, this is Dr. Alcena saying so long and bye-bye.